And for those who don't know much about the community health centers or the FQHCs around the state, it's a great model, federally funded. About 40% of our budget was provided by the federal government. It wasn't a free clinic. A lot of times people think community health center, they think free clinic.
Right.
The big thing is they don't turn people away if they can't pay. So we put everybody on a sliding scale. So based on your family size and your income. So most patients, if you didn't have insurance, you were getting seen for $30, and that was to see me as a provider. They could get labs done.
Right.
They had pharmacy on site, which had 340B medications. And for those listening who might not be familiar with 340B, it's basically a government program that allows you to buy medications for cheaper. So we could get insulins for really cheap. We could get a lot of diabetes medicines that are costing $400 and $500. We lowered the price to $10 or $20 for patients.
Oh wow.
So,
Okay.
yeah, and the good thing with that job is it allowed me to see that when we talk about health equity, if you take away quit defining people by the type of insurance card they have, and you give people equal access to certain medications and care, you can have equal outcomes. So I had uninsured patients that could see a dietitian, see a diabetes educator, and get access to affordable medication through our pharmacy, and they were controlling their diabetes. Whereas if you go somewhere where they're having to pay, you got to pay $200 to see your doctor, and then you get prescribed a $200 medication, like, of course, you're not going to have good outcomes because you can't afford the medicine. You can't afford the care. So
no wonder people are going to fall through the cracks, right? If there's no way for them to get entry into the system.
Yeah. And there's a lot of factors to it. I don't want to gloss over. It's not an easy solution. If it was easy, we wouldn't have, health inequities here and stuff. But I do think that the FQHC model provides a great framework for how, care can be provided to all communities.